Ever felt frustrated being told PMS, heavy bleeding, and cramping are just normal parts of life? You are not alone. I loathed my monthly cycle for decades. That all changed when I earned 3 health coaching certifications discovering something incredible. Your period is vital. It is an outward sign of your inner health, and it holds the key to unlocking your full potential. I've been there battling heavy, painful periods, and I turn them into cycles with minimal PMS and cramping. Today, I'm on a mission to share that information with you. Pour a cup of your favorite drink, get comfy, and grab your headphones as we embark on a candid and empowering journey of self-discovery. Together, we'll demystify menstrual cycles, explore cyclical living, delve into natural birth control, and guide parents through those crucial period talks with tweens and teens. It's time to break the taboo around menstruation and embrace the wisdom it holds. I'm your host, Heather Allmendinger, and this is the Embracing Flow podcast. Hello, everyone, and thank you for joining us today on Embracing Flow. I'd like to introduce our guest today, an expert at Embracing Flow, Dr. Jeffrey Brown. Welcome, Dr. Brown, to Embracing Flow.
Oh, thank you. Thank you for having me. It's an honor and privilege to be here.
I am humbled to have you here. Guess here's why. Dr. Brown is an osteopathic functional medicine physician. He attended the New York College of Osteopathic Medicine, completed residency at the Jamaica Hospital Medical Center, Mount Sinai School of Medicine, Department of Family Medicine. After becoming frustrated with traditional medicine's approach to healthcare while practicing family medicine, he became board certified with the American Academy of Aging and Regenerative Medicine. He has been focused on improving women's healthcare for over 15 years. His passion is helping us women eliminate painful menstrual cycles. I love having guests such as you on because you've seen how it impacts our lives. What brought you into the field of menstrual cycles, and what were you seeing? You're like, hold on, something needs to change.
Well, you all brought me into it. So I was I was interested in more in the alternative world. That's why I went to osteopathic school. I wanted to learn, the hands-on approach, in addition to just writing scripts. I wanted to be able to be, have more tools in the box, to say the least. And I remember having my family practice, and at that time, we started hearing from like Suzanne Summers. She was on Oprah. She was on Dr. Phil, talking about the bioidentical hormones. And my patients, started asking me about it. And as you know, at that time, it just wasn't common. It just wasn't, it wasn't taught in medical school. It wasn't really talked about, at different conferences. I really had no knowledge of it whatsoever. But I was close to my patients, and more than one of them kept asking about it. So I was fortunate enough to have a relationship with one of the compound pharmacies, who I started working with, doing some weight loss program. And so they invited me to a conference with them with PCA, and they're one of the organizations that they get their resources from when compounding bioidentical hormones. And from that conference, it blew my mind. It changed my life, because after that conference, I was like, wow, okay, there's a lot here, to this, a lot of good science behind it. It gave a lot of explanation of why, women were suffering the way they were. So then after that, it was just a journey. I said I needed more information. And then that's when I started, searching, and living in Vegas at the time. That's the biggest A4M conference, in the country. And so in December, I went to my first A4M conference and learned more about the hormones. And I said, okay, I need to, do this and get certified. So yeah, you all led me to it. And then it just opened my eyes to, more that we can do. And that's what I was been looking for a long time, is truly the functional medicine world. I just didn't know what functional medicine was. Didn't never heard of it, back then in 2008. And now it's, a lot more common, but back then, I didn't really have never heard of it.
For those that functional medicine has kind of become more of a buzzword in a
Yes.
way.
Yeah.
What is the difference between the osteopathic versus the functional and the regenerative? Where's the bridge? How are they all in one family but different?
That's a good question. So there's DO, because people ask this question all the time. You get DO, doctor of osteopathy, and then you have the MDs, which are allopathic. All right. And allopathic means disease oriented, which makes sense if you think about the conventional world is really disease focused. Osteopathic means, stimuli from the bones, the spine, the spinal cord, everything kind of comes from there. But the osteopathic principles believe their foundation is the body has what it needs to heal itself. It just needs help. And that's what the osteopathic principles, are founded upon. That's what we have the hands-on approach. So osteopaths in general tend to be more holistic in philosophy. And so functional medicine was just, another stepping stone, another bridge where you truly look at the whole person. And that's really what functional medicine is, looking at the whole person, looking at their environment, looking at their food, how are they born, C-section, vaginal delivery, were they breastfed, really getting understanding of where this person started to where they are now to figure out, what could have been some of these causes that led up to, the present situation. So you need time to, dissect and look at all that. And so that's the functional medicine world. Osteopathic medicine, is still, medicine, it's still medical school. And most people, when they graduate, they go into the different specialties, whatever that may be, you know, orthopedic, pediatrics, family medicine, it could be any branch of medicine, but functional is a whole different, beast, but still with that principle that body can heal itself.
And I personally enjoy and fall into that philosophy that the body can heal itself with the correct support.
Yeah.
Um, Medicine can help it on that journey, but the body is capable of healing itself with the correct support underneath it. With with cycles, you've seen probably it all. Um, what is one of the main, I know the word I'm looking for, and it's not symptoms, but complaints that you get in your practice from women? They come in. Is it the heavy periods? Is it the brain fog? What are some of the main symptoms that you're seeing in your practice that is kind of common amongst your patients?
Interesting question. And I guess it would depend upon the age of the woman, right? Because you have the women that are in their 20s, and I see them. And then you have the women who are 35 to 45, in that trend, that perimenopause, transition, so I'm going to see different symptoms. The younger population that comes to see me, it's going to be because of, more pain. That's really the biggest, painful periods. They may have severe, the PMS symptoms, so that could be the bloating, which is really bad. They may have the headaches, the menstrual migraines that go along with that. The breast tenderness, where they don't even want to put a bra on or touch themselves, during that time. They may or may not have, heavy periods, but the PMS symptoms tend to be more significant in the younger, population. Sometimes they'll have the gastrointestinal symptoms that go along with their cycles, the diarrhea, or they get really backed up, something along those lines. And then when they get the perimenopause, that's when I see more of the brain fog. Um, the mood swings can be in both. I can definitely see that. That's in both, younger and older, where the mood swings, that hasn't changed. It's like, okay, they can be really irritable, very angry. I think I hear that more than I hear about the sadness. I think I hear more of the anger, the short fuse. They're snapping at their kids or their significant other, and they're like they're watching themselves do it. It's like an out of body experience like this. Like it's just I can't control it. It's just kind of it comes out. But then that's the brain fog. So in their 40s, they're like 40s or 50s, where they can't remember things the way they used to. They're not as not as sharp. Especially the people whose business they rely on their brain to function well, and that's one of the biggest frustrations. Like, yeah, my brain is not, I can't focus as well, not as sharp. That's very frustrating. And then the joint pain too. In that perimenopause phase, they start having pain they never had before. Whether it's their hands or a big one, the knees, just joint pain in general. And so it really depends upon, what age are we catching them where we're going to see the symptoms. But it could be all over the map. They can't sleep. Some people struggle with that for most of their lives. And some people, it gets worse when they hit the perimenopausal, part of life. Sleeping is a big deal. So then if you can't sleep, then of course, then they're tired. And then fatigue is a big thing. So yeah, unfortunately, I've met people who struggle for, 20 plus years with their cycle, and it's a shame. And it's like, I wish I had met you years ago. We could have fixed that instead of you suffering for so long. But unfortunately, it's this, it's not set up in this country to really help you guys, with your cycles for those who have discomfort.
That is true. I was one of them. Uh,
Yeah.
and I didn't find out until way later than I wanted to how, when they say pain periods aren't meant to be painful, yeah, I didn't believe that until I had my first pain-free cycle without medication. Uh, the symptoms that are coming in, are you seeing that traditional medicine is helping that, or is it more lifestyle and things that they can do without prescriptions helping a little bit more with those issues?
Well, unfortunately, conventional medicine has failed women, in this country, probably in the world, because I'm seeing people all over the world having issues with the same thing. So it's not just in the United States. Um, Big pharma plays a big role in healthcare, or I should say, sick care. Is really not focused on getting us healthier. It's really masking symptoms. And unfortunately, with women, you have a couple options. You have birth control, you have antidepressants. They quickly brush you off, and then you have surgery. So they really don't. There's really no true healing going on. There's really no true getting to the root cause of your discomfort, whatever that may be. And discomfort, I think, is not the right word, because some people is really debilitating pain. Like that's, discomfort is not the right word. There's some people who really struggle, with it. They maybe can't keep a job because they're missing too much work because of, the pain, the pelvic pain, the back pain, heavy menstrual periods, which lead them anemic, and then it's a cycle every month, So discomfort is not the word for some of the women out there. So no, they have done a disservice, to you guys, which is why I've been focusing on it, more recently, especially with the painful periods with people with endometriosis, adenomyosis, those painful periods that truly disrupts, your life. Because really there's not much, I don't want to use the word hope, but I can use that because I think most women feel like that's where they are. That's what they're going to have to live with the rest of their life. They feel stuck there. Um, they may have had one or two surgeries already or contemplating surgery and hoping that will, take care of it for a period of time. Birth control doesn't really work with a lot of women, a lot of side effects with the birth control. So what are you left with? They know they're not crazy. They've been told just take antidepressants, but that's not really, a viable option. It's really a slap in the face, really, right? It's like, what are you telling me? It's all in my head. Like I'm imagining this. I'm just depressed. Well, of course you're depressed because you're in pain every month, right? Your life is turned upside down. You can't take care of your kids, or maybe you want to have kids, but you're having a hard time conceiving because you have, endometriosis or adenomyosis or some other, hormone imbalance that's preventing you from getting pregnant. So, yeah, no, there's been a disservice here with women's health, and it's sad, which is why I'm passionate about it, because there is hope, and that's been my passion to teach people is like there is help, there is hope. You're not stuck.
We are very, very fortunate that you are here. For those that aren't sure, they haven't been diagnosed, but they've heard of endometriosis, can you share what endometriosis is as well as adenomyosis, what they are, how they differ, what hormones might be at play with these? Because I know that there is a difference.
Yes. Now this is long. There's a lot here. So I know that there's a lot of women who suffer every month, and they may not even have that diagnosis. They say on average it takes 7 years for a woman to get diagnosed with endometriosis. And I have seen actually quite a few women recently whose doctor won't even run tests. They just want to put them on birth control. They won't even entertain the notion of let's do some testing, let's do an MRI, let's do a vaginal ultrasound. They don't even want, don't even want to address it. So then I know because of that, there's a lot of women out there who will never get diagnosed with, endometriosis or adenomyosis because what's the treatment going to be anyway? In their minds, well, yeah, we're just going to put you on birth control anyway. So what's the point of even, testing you for it? So they just rather not even go down that road, which is it's unfortunate because I know a lot of people, at least when they have that diagnosis, they can at least say, okay, at least I know what I have, and let's put a plan of action together, potentially. But endometriosis is an inflammatory condition. It's a pro-inflammatory condition. It's immune dysregulation. There are cells similar to your cells in your endometrial lining, and those cells grow and that tissue goes and displaces in other areas of the body. Most commonly in the pelvic region. It could be in the ovaries, fallopian tubes. It could be in the abdominal cavity. It can go to your spine. They've even seen it in the thoracic lungs. They call it thoracic endo. They've even had reports in the brain. Sciatic nerve. So these tissues grow. They can cause scar tissue, inflammation, and really disrupt that area. Where that tissue has spread. And so you can imagine the pain when that tissue flares up every month with that cycle. You can't even imagine. That's why it's so debilitating. If it's in the pelvic region, the abdominal region, um, yeah, really, yeah, that's a excruciating um, situation to be in. So that tissue could be anywhere in the body. Really. I don't know if there's a place that they haven't seen it, and so that can lead to a lot of pain. And pain is really the underlying theme here because adenomyosis is also pain, except that the tissue now and the endometrium goes inside the tissue, inside the muscular wall. So it stays in it. It just goes deeper in. So you'll see lesions. If you look at a CAT scan or MRI, those lesions are, internal. They stay there. So they're not leaving the uterus. They're just staying internally. So they're still having a lot of pain. Both of them you will see will maybe experience pain with intercourse. You may see they both have difficulty conceiving. Um, Endometriosis, they may have a lot of pain with, urination or even going to the restroom, saying number two, defecation. Pain, is really the underlying thing there. So it's not just minimal pain, but pain that could be debilitating, pain that, some ibuprofen 800 still not can barely touch where the pain is that severe. So it's not like just little cramping. People unless they understand how debilitating that pain is, it's next level pain. Some people want to minimize it, but like, no, no, this is severe pain. And so that's the most common thing is really the theme is pain, severe pain.
Yep. One of my mentors, um, she lived with endo for years, and she said for a majority of her 20s and 30s, 2 weeks out of the month, she was in bed in pain. It took all she had to get up to go to the bathroom. Um, I mean, it's debilitating. I know other individuals that it is debilitating. They can't get out of bed. It hurts too much. Their functionality is minimized significantly because movement hurts.
Mm.
Laying down hurts. And like you said, it's not minimal pain. It's 8, 9, 10 level pain, putting you into tears and dropping you to your knees.
Yeah, imagine when you go to the bathroom, you're in pain. So if you're laying down, you're in pain. You need to urinate, you're in pain. You need to relieve yourself as pain. Like, you can't be intimate, or the thought of intimacy gives you PTSD. That was one of the expressions a patient told me. It's like, yeah, the thought of it gives me PTSD. And I'm like, wow, that's a way of like, wow, okay, that's sad. That's
Yes, it's
yeah,
heartbreaking.
yes, it is.
It's truly heartbreaking. And so, what are some things that you have found that help with this pain? Because we have heard that those that have endometriosis and the medicine isn't always necessarily helping.
It is.
What are what are some things that can help them whether they choose to try the medication or they don't want to use the medication and the option that the MDs are giving them.
Well, it's one is going to be is a commitment because you have to have a holistic approach. Endometriosis, it's not a the problem that I have with conventional medicine, and it's with any disease, we want to think is it's one thing, just take this one pill, this one magic pill, and it cures the problem, right? And that doesn't work. Endometriosis is complex. It's hormone related, it's inflammation, it's immune dysregulation, it's gut dysfunction. So there's a lot of players, involved here. So the first thing that I focus on, well, I guess it's always a combination of one, is stress. Stress affects everything. And I don't think people truly recognize or realize how much stress plays a role in our health. I think it's too minimized because when I ask people, are you doing like what I like to call stress reducing activities on a regular basis? Most of the time is no. We're in fight or flight all day long. It's just the rat race. And cortisol affects our hormones. And well, obviously, cortisol is a hormone, but cortisol and progesterone, they're like a seesaw, on the playground. So if stress is high, that means progesterone is down. So progesterone down, well, that means estrogen is up. So then you're in an estrogen dominant state. And so estrogen is going to fuel more of those endometrial lesions, right? Cause more of that estrogen dominance. So if you're not managing stress, if you're not working on that, what I call rest and digest, working on bringing that parasympathetic tone down, that keeps progesterone down, then you're going to always still be stimulating that estrogen. So it's really important that you spend time, meditating, praying, going for walks, have a spa day regularly, get a massage. Like every day, my recommendation is 3 times a day, morning, midday, and evening. You need to be doing something that is in the rest and digest facet. Laugh a lot, play with your pets, go for walks, do some grounding, walk barefoot in the grass or sand, depending upon where you live. Like that is so important. But most people in that rat race. And so if you're still in fight or flight, again, that's impacting, your hormones in a negative way. So that's a big part of what I do is work on that. But then you got to work on the gut. And what's the number one thing when you work on your gut? Well, it's what are you putting in your diet, right? So when you're miserable, what kind of foods are people gravitating towards? It's usually the comfort foods that are inflammatory. So now you're adding more inflammation to the problem. Now I understand it, but then you realize too that but you're not helping yourself, heal either. And so it's like a catch 22 because you're miserable. So you're eating those comfort foods, but yeah, but you're making the problem worse. So you really got to look at the foods that you are consuming, right? So the foods are really important. So when it comes to the vegetables, fruits, if you are eating, apples, strawberries, grapes, anything that you're eating the whole fruit and the outside, you want to make sure you're eating organic, right? You don't want the pesticides because the pesticides are interfering with our hormones, right? We know there's a lot of endocrine disruptors out there, a lot of chemicals out there, those pesticides. And so you're not doing yourself any favors there. And I know it could be a little bit more expensive, but really your health is your wealth, right? So if you can't maintain a job because you're in pain, again, that's where we got to balance that out. Um, so diet is really crucial. Purchase foods that don't have the hormones in it. So that your meats, if you're having dairy, cheese, but that's an inflammatory food. But I know a lot of people love dairy, but just make sure that it doesn't have the hormones injected into them. So foods are very important. And so really the stress, the gut health, and then like I said before, the hormones, are really important in helping women with their pain. I mean, we could talk an hour about, with the hormones when it comes to that. So progesterone is really a big deal, right? There's herbs that you could try, chasteberry, vitex to increase the levels of progesterone. Bioidentical hormones, you can even buy, sometimes you can see the creams, in compound pharmacies, you can sell them, that you can buy them, over the counter, just make sure that they're quality creams. Birth control is not progesterone. That frustrates me to I can't tell you. Sometimes, even if you look at certain studies, they're using progestins, but they'll still interchange and call it progesterone, where it's truly not progesterone. And so, even though they say progesterone only pills, it's like that's not progesterone. Progesterone and progestin are not the same. If I could just stress that enough, they are not the same. Progestin
Yeah.
is not helping you. Progestin actually increases your risk for breast cancer. It can create some cardiovascular problems. Progestin is not what we want. And so obviously, the birth control is a big deal. So a lot of women are on birth control, and that can lead to candidiasis, candida overgrowth. Well, candida overgrowth, disrupt the gut microbiome, which can worsen the endometriosis, adenomyosis, all these other, period of problems, right? With the candida, it lowers testosterone. Testosterone is so important when it comes to, helping with endometriosis and the cramping. I know a lot of women think that testosterone is for men, but no, you guys really need it for mood. I've treated a lot of women who've had depression with testosterone, and they've gotten off their antidepressants just by getting their testosterone levels up to a certain range. But they've been on birth control for so long, and that lowers your testosterone levels. And then they wonder why later on, they're sad, they're depressed, they don't have the motivation, they have low libido. It's because of that. And so it's like a vicious cycle. Like they're trying to help. I mean, I know these doctors, they're trying to help with the tools that they have, but really it's not really, you know, doing what it needs to do, right? That's why I said we failed women, in this country when it comes to women's health. You guys have taken a back seat, the back burner when it comes to, your issues, So yeah, that's really, stress management, hormone balancing, uh, gut health, nutrition, self care. That is so important when it comes to healing. And so you can do a lot of that on your own. You just have to have the mindset, determination, the discipline, and not wanting to give up. That and believe that you can actually, heal this. And there's people who have by themselves when they really researched it and took the time and energy to do it. And you can do it.
Yep. I know several who have, and thank you for bringing up the difference that there is a difference between progesterone, our natural hormone, and progestin. I see it interchanged all the time
Yeah.
in on different places, and I just want to bang my head against. I'm like, no, they're different. They are different. When it comes to um I know that there was a recent thing about you had mentioned testosterone
Mm-hmm.
and how it impacts the body. We kind of know a little, we've heard a little bit about estrogen dominance and low progesterone, um, and the low libido with the testosterone. What else does testosterone play a role in within our reproductive system, but then our overall general health?
Great question. Because testosterone, especially, women don't think you need testosterone, right? Just like guys, oh, we can't have any estrogen. No, we need each other's hormones, right? We all have the same hormones, they're just in different ratios. Now, it's interesting because endometriosis is, like I said before, it's a pro-inflammatory condition and it's closely linked to autoimmune diseases. It's not an autoimmune disease, but it's closely related. I would say they're very close cousins. And they've seen a close correlation with endometriosis as well as other inflammatory diseases. And so when you look at that, 80% of the people who have autoimmune disorders are women. And so we have to look at that and say, okay, wow, that's a lot, right? Women making up 80% of that. And so one of the theories behind it is low testosterone because testosterone modulates the immune system. And as you know, with autoimmune diseases, pretty much the treatment in the conventional world is to put you on immunosuppressant, right? Just pick one, and that's what that is. Where testosterone is an immune modulator. And so I found by working with testosterone with women, it's helped a lot with pain. It helps a lot with inflammation. Um, it helps a lot with um, motivation, like the drive to do something. I had one patient say to me once, "This is what it feels like to be a guy. Like be motivated, to be driven, so like I could conquer the world." A little bit of confidence once they got their testosterone out, it just made me laugh. I was like, "Yeah, when those levels are where they need to be, but too much of it's not good either, because then that can make you irritable and like that's everything has to be in balance, right? It doesn't matter which hormone it is; it needs to be in balance." So yeah, the immune system is really is a big deal there. because like I said, 80% of autoimmune patients are women, and that's one of the missing factors. And the men that I've seen that have autoimmune disorders, they tend to have lower testosterone levels as well. So I said, yeah, I'm seeing this theory kind of run true with the women who have endometriosis. They're always low. Every single one of my endometriosis patients have been, I put them on testosterone. And pretty much, yeah, every autoimmune patient I put on testosterone, and it's made a big difference because it's not just about a healthy libido, and a sex drive. It's maintaining bone mass and health and muscle and energy, endurance. Especially a lot of women complain of fatigue. All of a sudden, their testosterone levels come up and their energy is better. The mood is more stabilized when the testosterone levels are optimized. So mentally, physically, neurologically, with the pain, testosterone wears a lot of hats as well. So for women, it's not just about estrogen, progesterone. Testosterone plays a huge role there as well. So then you ask yourself, if you're a woman and you're seeing a gynecologist that they're not talking about testosterone in their primary care, so how can you increase your testosterone levels, right? Well, exercise, strength training, specifically your legs, the biggest muscles in your body. Um, Doing strength training can help to increase your testosterone levels. So doing those lunges, the squats, leg presses, those are things. Work on building those muscles there, that are very important. Unfortunately, you know, most people are not exercising. And going for a walk does not count as exercise. Sorry, when I ask that question, people say I go for a walk. Like I just shake my head. It's like that's not exercise. Exercise is challenging the body. So you have to break it down so it can build up stronger. If there's no resistance, then I don't consider it exercise. But really, lower body exercise, strength training is really essential for helping to build muscle and to increase your testosterone levels.
I've also heard for those that are in perimenopause and menopause, by strength training, it actually helps us hold on to our bone density. Even with estrogen declining and our hormones going on to a more level plane once we go into menopause, that strength training reduces the chances of osteoporosis and osteopenia.
Exactly. Yes. Exercise. I mean, if you could bottle up the benefits of exercise and put it in a pill, we would all be healthy, and big pharma would go out of business because there's so many benefits to exercise, especially with strength training. Strength training, there's so many benefits for it. I mean, we could talk all day just on exercise as well. But one of the things you need to talk about is what it does with insulin, because higher insulin levels can disrupt ovulation. And you need ovulation in order to body to produce progesterone. So if you're not producing progesterone, well, that means you're going to be in estrogen dominant phase again, which can lead to more of the cramping, endometrial tissue, and all the other things that go along with estrogen dominance, right? So that's another reason why exercise and strength training is really important because you want to manage, insulin, and keep that under control.
I'm hearing your words echoing back what I share. I love it because it is so true. And I have fought, not necessarily fought, but and with the exercise, it doesn't have to be a lot. I
Mhm.
found 15 minutes a day of body weight training
Yes.
is my body reacts very, very nicely. I slim down, the bloat goes away, the inflammation goes away, and it's not like I'm in my ovulation window every single day, but I look in the mirror, I'm like, ooh, I got some curves going on today. And it doesn't take long to do that. And it's not hours and hours and hours in the gym. It's 15, 20 minutes of body weight exercises.
YouTube has a lot of people out there demonstrating 10, 15, 20-minute home workouts that you can do. Like, everybody knows, just go on YouTube, you can find videos, and really you can do a great uh, home workout where you're sweating, you're burning, it hurts, in 15 minutes.
Yep.
You do that 3 days a week, you're ahead of the game. You're right where you need to be. Like you said, you don't need to spend a lot of time or even go to the gym. If you're disciplined enough just to turn on your TV or your phone and do those exercises, it can go a long way, to helping you manage your symptoms and correcting it. and helping your body to get out of that funk.
Yep. And then with that as well, that self-care, you go through, you do that workout, you're all nice and hot and sweaty. Turn on that yoga, turn on that stretching, and
There you
you're
go.
bringing your levels back down. You're getting into that parasympathetic, and then you just feel kind of nice and warm and juicy. And you're like, all right, yep.
Now you get it. Exactly. Yeah, exact. That's what I was talking about.
2 to 3 days
Exactly.
a week. I
Yes,
it and yes, you're like, it's 10 minutes. I can do 10 minutes. But that motivation to do those 10 minutes is sometimes really, really hard.
it
I
is.
know. I've done it. It's a battle for me on a regular basis. It really is.
Yeah, once you get started, you make a commitment. Before you know it, it just becomes habit. Once you just just take that step. Maybe the first time it's just okay. Let me find a video I like. Maybe that's the first day. You find a video that you like, and you say, okay, now maybe maybe you need some new shoes or something, or maybe you got to get some 5 pound, 1 pound, whatever it is, just to kind of get prepared. And before you know it, you say, okay, now I'm ready to do some home exercises, and just keep it simple. And before you know it, you're gonna start getting hooked. The endorphins kick in. You become proud of yourself that you've accomplished something, and then you just want to keep going with it. And before you know it, you're in a completely different place.
And you're not talking like 8, 10, 15 weeks. I've seen changes in 4.
Yeah.
It,
Hmm.
it I have seen changes in 4 with what I've gone through. I've seen others that have seen changes in 4 with not really changing anything else, just bringing 10 to 15 minutes into 3 times a week. Hey,
That's it.
Psyche, just do it. Um,
Just do it.
you you have a program coming up that you're giving information about endometriosis, if I remember correctly. Can you tell us a little bit about your program?
Yeah, so my program focuses on women who have significant debilitating periods. So you may not have a diagnosis of endometriosis, but if you do have a diagnosis of endometriosis, then that program is for you. Or if you do have a diagnosis of adenomyosis, then that program is for you. If you know you're suffering every month, you're having a hard time keeping plans, keeping a job, you're missing work, just because of your period pain, whether it's back pain, pelvic pain, most likely you probably do have one or both of those conditions. So my program is a virtual program, so I can reach people all over, and it's basically something to teach you, guide you. It's a 6 month program that I put together so they can go through it and learn and do what's necessary for their bodies to heal itself. And that's the goal because it's doable. I've done it. I've helped people help themselves because really a lot of it is you're doing the work. I just guide you and support you along the way and tell you what you need to do. We're looking at different labs, specialty labs, which are very important so you can understand, where the hormones are, where the toxins are, the toxins that may or may not be present in your system, looking at your gut microbiome, what's going on with their gut health, because we know that's a big deal. Looking at the hormones, the stress hormones, what is that looking like? And so then you address all those things. And so it's a holistic, systemic approach because that's the only way that you can truly address this is by addressing the whole body, mind, body, spirit, kind of as we talked about, before. So that's what this program is. And so the goal is, as you go through, you're educating yourself, you're learning a whole lot, you're discovering what's going on through the testing, and then you're addressing those things. And so that's what the program is over those 6 months. And no, I'm excited. Want to help as many people as possible with this because unfortunately, and I know this, most people don't think they can heal. They think that where they are is where they're going to be and have to live with for the rest of your life. Um, and that is not true. Um, Quick story, because I actually spoke with her today as a friend of mine. She's the one that actually motivated me or kind of inspired me to really look into endometriosis, adenomyosis, and focus on it. She was a friend of mine, and she used to suffer from endometriosis, and I didn't even know she had it. It's not something that I think women talk about. If you kind of suffer with it, a lot of women suffer in silence, right? When you're out and about, you put that face on, right? You say, okay, just that energy face, and you don't want anybody to know that you're suffering. So when you're out and about, you just, do what you do, right? So you can push through, right? You've been taught that you got to push through pain and push through everything. And so one day I just noticed her mood didn't seem right. Her energy didn't feel right. And she was telling me because I couldn't remember exactly, how we got started with it. And anyway, so she was telling about her mood, and then of course, being the physician I am, that made me ask questions, and then those questions led to the cycle and period because that's what I do work with women's health. And then she told me she had the endometriosis, and I said, oh, okay, endometriosis was on the depot shot, which a lot of women are, and antidepressants, because of the mood, disruption. And I was like, okay, I can help you. And the fact that I told her that I can, fix that for her, she had to look because she'd never heard that before. Like she didn't think it was possible. She had already accepted the fact that she's going to be living with this until, she no longer has a period, right? She had accepted that. So I was the first person who ever said that, no, you can fix that. And I'm a confident person. So I said, yeah, we could fix that. And then, eventually she said, okay, can you help me with this? And I said, yeah, of course. And so the first thing I said was, okay, we got to get you up to depot shot. And the look of fear on her face was something I'll never forget. And I was actually laughing about it with her earlier today because we were talking about this because she was so petrified. So even though she wasn't in a good place, at least the depot shot helped to calm the pain down to a point where it's relatively manageable. Like, she was frustrated where she was, which is why she came to me and said, hey, can you help me with this? Because she had reached a point where like, I'm done. I'm frustrated with, living this way. Because I asked her, I said, you talk about this with the other girlfriends? And because I'm just curious, I'm not a woman. So how do you guys talk and support each other? She's like, no, not really. It just only came up when I had to cancel plans, because of, when the pain came and hit me so bad. It's the only time it really came up as far as, talking about the cycles. I was like, oh, that was interesting. But the look on her face, the fear of having to stop that birth control, was priceless. I never forgot that because she literally it was like fear went over because the thought of her, that pain that she used to have, even though she still had some, but the amount of pain and the degree of pain was she was like couldn't fathom it. But she said, okay, she trusted me enough to stop it and put her through the program, working on the gut, working on the stress, doing all those things, then working at balancing the hormones. And now, she's off antidepressants, she's of course off the depot. She feels better than she ever has. Her cycles are uneventful, no cramping, no pain, no mood swing, like nothing. And she was like, she just she's like, I'm so grateful. It's like you changed my life. And she's like, I thought I was gonna live like this forever. And that's like you did the work. I just guided you, told you what you needed to do, along the way. And she was obedient. She did what she needed to do. And now, she's living her life. Like she never thought that she could. And so, not on birth control, didn't have to have surgery, not on, antidepressants, her moods are fine. She's enjoying life. She has confidence in her body now that's going to function well, making plans, whatever it is that you want to do, body's not failing you, failing her. I know a lot of women think, okay, what's going on? You never know what's going to happen. And so it is doable. So that's one of my missions is to let people know, is like, no, it is doable. It's very doable. You don't need to live that way. Don't accept it. Just because another doctor said this is it, there was nothing more we can do for you. That's nothing that they can't do for you. But no, you can, get better. That's the thing is that they've been told that there's nothing else that can be done, right? Because they've seen all these gynecologists or so-called endo specialists that are surgeons. They go in there and scrape the lesions, find them, and then it comes back, years later, and it's like, well, that's all we can do. Like, no, there's more that you can do. There's a lot more you can do. You gotta just look at the body as a whole. There's a reason why you're in that state. Now we just need to address it, unwrap it, and then, you know, when I say rewrap it.
Yep. With the correct
Yeah,
wiring.
exactly. Yes. There's
Is
different reasons for it. For whatever reason, genetically, I know some of the stuff they say can be passed down. What did you eat growing up? Before you started having your cycle. Some of those things are already set up before you even, had your cycle. It's just once you get the cycle, boom, the dams burst open. So,
Yep.
but no, we can reverse that. You just got to be willing to put the time and the effort, into it.
Yep. And I I I did it myself. It is definitely possible. What you are doing is absolutely phenomenal, and I know that there are a lot of women that needed to hear what you've shared so far today. Before, where can we find more about what you do, who you help, how you help them, more about the course that you're the 6 month program? Where can we find more about you?
So my website is Hormone Health with Dr. Brown, and that doctor's DR, right? Hormone Health Dr. Brown .com, and on there we do have more information, the social media links. I do have YouTube videos and putting one out every week, really trying to educate women out there, little tidbits that they can do to help themselves. I do have a free webinar coming up March 11th, where I'm going to go more into what we can do to help you, and kind of break that down, looking at the three different pillars that I have that really help to change the body, support the body, to reduce the inflammation, to help the hormones become more balanced and optimized. And so those are key. You gotta help your body detoxify. We're exposed to toxins all day long, and so the detoxification pathways aren't optimized, or they're not open, not being able to do what they need to do. We're going to have problems because things kind of get recycled and reabsorbed, and we don't want that. So that the webinar is going to talk about that and walk us through. And so that's where you can find more information about what I'm doing.
I am sure your website and different things are going to start blowing up here because you've given so much information, and I know you have so much more to share with those that are dealing with this. But before we go, do you have any wise words of wisdom to take with us?
Two things, and I've said it before, but I really want to to hit home with it, is pamper yourself. You have to do that. You have to start putting yourself first. You have to get out of that fight or flight and giving yourself to everybody else except for yourself, and you have nothing left. Like you got to do that. You got to get out of it. You just gotta. I can't stress that enough. It's like you rest and digest. Rest and digest. So you really have to work on the parasympathetic system. And the second thing is, God designed us beautifully. We have the ability to heal. We just have to help it along sometimes and figure out what that is. So no matter where you are, it's not permanent. You're not stuck. Everything is possible. There's no disease that's gotten everybody 100% of the time. There just isn't. So just keep that in mind. Like wherever you are now, it can get better if you choose to. You just have to find the right people that can assist you along that journey. And so once you find that person, I would say hang on and you can get there. So there's always hope. Always. I don't care what it is in the health realm, but there's always hope.
Very, very true and wise words. Thank you so much, Dr. Brown, for taking us on this enlightening journey into women's health, endometriosis, adenomyosis. I I've learned quite a bit. I know my listeners have learned quite a bit. So thank you for being here on Embracing Flow.
Thank you for having me. It was fun, enjoyable, and I hope the women listening out there, just I hope that gave them hope that they know they don't have to be stuck, where they are. Um, and that's my mission, is to let them know and give hope that they don't have to be where they are.
We are in the same boat, my friend. We are in the same boat. All the links that Dr. Brown shared can be found in the show notes. Thank you, listeners, for spending your time with us today. If you found a nugget of wisdom or a moment of empowerment, our mission is accomplished. Do you know someone who could benefit from this information? Please share Embracing Flow with them. My friends, in every phase, embrace it, love it, crown it. Be vividus. Talk to you soon. Thank you so much for joining us today. If you enjoyed this episode, please follow the show, submit a rating and review, and share it with your friends. Visit my website, embracingflowpodcast.com, to receive your free guide on 4 ways to decrease PMS. The link is in the show notes. Information shared on the Embracing Flow podcast is for educational purposes only. It does not constitute medical advice. Until next time, love hard, laugh often, and always be vividus.